Moving on to the bones of the leg. We have the large bone of the leg on here, which is located on the medial side. This is going to be my tibia. And the tibia on here, this is going to be the bone that holds all your body weight down to the foot. All your body weight gets transmitted from the femur down to the foot by the tibia. The other bones that will share in the formation of the leg, it's going to be the fibula. Most common mistakes, people get confused with the names of the two bones. Again, what's the name of the large bone is my tibia, and the name of the thin bone of the leg, and here it's my fibula. So why do I have a fibula if it doesn't carry any body weight? All the body weight gets transported down to the foot by the tibia and not the fibula. Why would I have a fibula on here? The main function of the fibula is to create a surface area for muscle attachment. So rather than having only the tibia for me to attach the muscles to, I would have another bone which creates more surface area for more muscles to be attached. But the fibula itself, it doesn't carry any body weight. No body weight would be carried down by the fibula. It's too weak to carry any of the body weight. Moving on here to the different parts of the tibia that we need to remember. If we are looking closer on here, we can see it has two concave elliptic shaped articular surfaces. Those are my medial and lateral condyles of the tibia. And between the two condyles, we've got an eminence, an elevated part. This is called my intercondylar eminence. And from the name on here, what do I mean by intercondylar eminence? It's the elevated part between the two condyles. So how would I differentiate between medial and lateral condyles? How would I know which side is medial, which side is lateral? Remember, the tibia is the medial bone of the leg. So if you touch the inside of your ankle right now, if you touch the inside of your ankle, you will feel there is a bony eminence on the medial side. This bony eminence on the medial side of your ankle, it's the medial malleolus. The medial malleolus, it's on the medial side of the medial bone, which is the tibia. So this what tells you which side is medial, which side is lateral. So here I don't have a head like I do have for the femur. Here I have the medial malleolus. So the medial malleolus is going to be on the medial side. So the condyle here on the same side, this is going to be my medial condyle. And the condyle on the other side, this is going to be my lateral condyle. So again, important markings that we need to be able to identify. First one is my medial condyle. How would I know that this is a medial condyle? It's on the same side as the medial malleolus. On the other side, I have this concave elliptic shaped surface. It's my lateral condyle. And both medial and lateral condyles are going to be articulating, as you see on here, with the medial and lateral condyles of the femur to share in the formation of my knee joint. So you have medial and lateral condyles of the femur articulating with the medial and lateral condyles of the tibia. Moving on to the second bone located in the leg, which is going to be my fibula. Important structures that we need to identify here will be the head of the fibula, and down here, if you touch the outside of your ankle, the lateral side, the outside of the ankle, you will feel that you have a bony eminence on the outside of the ankle. This is what we call the lateral malleolus. Lateral malleolus or lateral malleolus, this is going to be this bony eminence on the lateral side, which is part of my fibula. And again, what did we call this one? This bony eminence on the medial side of the ankle. This is my medial malleolus or malleolus. And it's part of which bone again? It's part of my tibia. All right. One other important marking that we can see on here is this elevated bony eminence in the anterior aspect of my proximal epiphysis of the tibia. This is going to be my tibial tuberosity. Tibial tuberosity serves as a point of attachment of the patellar ligament. So if we're drawing on here, the muscle called the Quadriceps Femoris. Quadriceps Femoris has 4 heads. One head is going to be coming down from the anterior superior iliac spine from the ilium. Like this. And 3 other muscles will get their origin from the shaft of the tibia itself. So all this is my Quadriceps femoris. The Quadriceps femoris will form a tendon that will be surrounding this cube-shaped bone called the patella. And then as a continuation of the quadriceps tendon, we're going to form the patellar ligaments that will be inserted in the tibial tuberosity. So if we want to draw this separately, this is how it's going to look like. If this is my femur, like this. And this will be tibia with the medial and lateral with the medial and lateral condyles. And this is going to be my fibula like this. So here, this elevated part is called my tibial tuberosity. And it's a site of attachment again for a muscle. We call this muscle, as it has 4 heads, it's my quadriceps femoris. Quadriceps has 4 heads, like they are 4 fused muscles. And the quadriceps muscle has a tendon. What's a tendon by definition? Tendon, remember, it's the connection between a muscle and a bone. This is what we call a tendon. So the connective tissue that will be attaching here the quadriceps to the patella, actually it's going to be surrounding the patella from everywhere. This tendon on here is going to be extending beyond the patella and will be inserted and attached to the tibial tuberosity. So what is the tibial tuberosity is a site for attachment of? It's the continuation of the tendon of the quadriceps, but we don't call it the tendon anymore because you see on here, it's connecting the patella to the tibia. So those are 2 bones attached to one another. So what do we call the attachment between 2 bones? It's a ligament. So we're gonna call this part on here, this is the patellar ligament. So again, what is the function of the tibial tuberosity? Tibial tuberosity is the site for attachment of the patellar ligament. And you understand now that the patellar ligament is just a continuation of the tendon of the quadriceps femoris. Moving on to the bones of the foot. If you remember, when we discussed the bones of the hand, we stated that the hand is formed of carpal bones, metacarpal bones, and the phalanges or the fingers. If you remember, when we studied the bones of the hand, remember, we started from the carpal bones, and remember, we did have 8 carpal bones. And attached to the 8 carpal bones, we've got the metacarpal bones. And the phalanges. Remember, how did we remember the names of the carpal bones? We use the mnemonic, says Sally left the party to take Kathy home. And remember, how did we use it? We started from lateral to medial. We started with the proximal row, and then we go to the distal row. And how did we recognize that this is the lateral side of the hand? Remember, it's on the same side as the thumb. And how did I recognize that this is the thumb? Because simply the thumb is the only one that has a proximal and a distal phalanx. It doesn't have a middle phalanx. All right, unlike the rest of the four fingers, they will have proximal phalanx, middle phalanx, and the distal phalanx. So the thumb here is what told me that this side is my lateral side. So I started with the lateral side, the proximal row first, and then my distal row. So I started here. Sally left the party to take Kathy home. Remember, those were scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, and hamate. Those are my carpal bones. Remember, the metacarpal bones, we didn't give them names, but we've given them numbers. So starting from the lateral side as well, thumb is going to have first, next is going to be second, third, fourth, and fifth metacarpal bone. So in the foot, we're going to be doing exactly the opposite of what we did with the hand. So the easiest way for you to recognize this time, it's not carpal bones, those are called my tarsal bones. And they are not attached to metacarpal bones. Instead, they are attached to metatarsal bones. Remember, we started from lateral. So here we're gonna start from medial. And how would I recognize that this is the medial side of the foot? The big toe gonna have only a proximal phalanx and the distal phalanx. It doesn't have a middle phalanx, unlike the rest of the four toes. The other four toes gonna have proximal phalanx, middle phalanx, and the distal phalanx. The only ones that has proximal and distal only, this is gonna be my big toe. And the big toe tells you that this here is your medial side. So we're gonna start from medial and we're gonna go lateral. We start from the distal row and then we're gonna be moving proximal. All right, for the tarsal bones, we do have only 7 tarsal bones, unlike the carpal bones, we did have 8 carpal bones. So for the tarsal bones, I have 7. For the carpal bones, I have 8. So first 3 that we're looking at in here, first one on here on the medial side in the distal row, this is gonna be my medial cuneiform. Comes next is gonna be my intermediate cuneiform. Next is gonna be my lateral cuneiform. So you have 3 cuneiforms. 3 cuneiforms. This is my medial cuneiform, intermediate cuneiform, and lateral cuneiform. All the 3 are articulating posteriorly with the navicular bone. navicular bone as well as the lateral cuneiform are going to be articulating with my cuboid. So again, start from medial to lateral. We started with the distal row first. We have 3 cuneiforms. We start medial cuneiform, intermediate cuneiform, lateral cuneiform. And then all the 3 are articulating posteriorly with my navicular bone. Both the navicular and the lateral cuneiform are articulating with my cuboid bone. Posteriorly, we've got here articulating with the navicular as well as the cuboid. We've got a superior bone that will be carrying the weight down from the tibia. This is called my talus. And the bone of the heel, this is called my calcaneus. So again, looking at the tarsal bones, we start from medial, going laterally. We start with the distal row, and then we go proximal. So we start medial cuneiform, intermediate cuneiform, lateral cuneiform. Those 3 again are articulating with my navicular bone. Navicular bone. Navicular bone as well as the lateral cuneiform are going to be articulating with my cuboid bone. Look on here, carrying the body weight down from the tibia to be distributed to the rest of the tarsal bones. It's going to be my talus. This is my talus on here. And the bone of the heels, this is going to be my calcaneus. 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 For the metatarsal bones, we don't give them names, we give them numbers, but again, we are moving in an opposite direction to what we did with the hand. Remember, in the hand, we started from the lateral side, but here in the foot, we're gonna start from the medial side. So always start from the finger or toe that doesn't have a middle phalanx. So here in the foot, we're starting from the big toe. In the hand, we started from the thumb. So start numbering. This is going to be my first, second, third, fourth, and fifth metatarsal bones. All right. Any questions? Any questions? Questions? Yeah, this is the only option. You mean on here or using the courseware, visible body? On the left, yes, this is the only options they give me to write on here. This is the only options that I have in this application. But again, this is first, this is the second, third, fourth, and fifth. All right, so you start from the medial side. All right, the side of your big toe. Questions?